And then coming to aneurysm. An aneurysm is an abnormal dilatation of the blood vessel. So we have already discussed in our cardiovascular system chapter what exactly an aneurysm is and what are the complications of an aneurysm. The complication of an aneurysm is it can dilate abnormally, and finally it can result in dissection and rupture of the blood vessel, giving rise to thrombus or embolus, resulting in a shock because the patient dies of a cardiovascular collapse or a circulatory collapse because of excessive bleeding. So again here in the same case as that of AVMs, which is arteriovenous malformation, we also have the simple and the complex aneurysm. So how do you differentiate which is a simple and which is a complex aneurysm? Please refer to your CPT manual guidelines, where if it says if the dimension of the artery is more than 1.5 centimeter, it becomes a complex. Or if it is intractable, or if it is too deep to penetrate for the physician, it becomes a complex aneurysm. Or when the vessel has undergone a pathological change like calcification or atherosclerosis, that becomes a complex aneurysm. So we have also discussed in our CVS chapter is what happens when there is an excessive triggers that are being formed, or when there are electrical activities which are more than in excess.